today is a significant day.
At the Tarrant County Commissioners meeting, their public health director shared the concerning update.
As of this morning, we've declared we have a 6th case, our first case of local transmission, meaning we don't know where this person got it from. What I can tell you to reassure everybody is person was a healthcare worker and had been seeing sick individuals throughout the week, so that's the likely source, but we don't have an identified contact at this point.
Healthcare workers continue this dangerous job facing challenges, including a shortage of masks and respirators known as personal protective gear. Texas DSHS did tweet some good news that they requested and received a share of that personal protective equipment from the Strategic National Stockpile.
I think everybody right now is in a little bit of a panic mode.
Tammy Eads is with the Texas Nurses Association. She said their nurses are overwhelmed.
We can't abandon our patients, and so if we don't have a nurse to replace us at the end of our shift, we pretty much have to stay there till we do have replacements. So I'm hearing that some of the nurses are getting really burnt out, especially like in the geriatric population, the nursing homes, things like that.
The healthcare worker with coronavirus is employed in Tarrant County, a place that has not yet shut down restaurants and bars. Today, county leaders told us they will continue to evaluate their options as the coronavirus makes its way through Texas and now to a worker on the front lines.
Nurses are flexible, and we will make it through this.
In Dallas, I'm Alex Rose.